Hey there, awesome folks! Making those tricky handwritten prescriptions easier to read in Papua New Guinea. Let's dive in. Easy tips to make reading prescriptions simpler. 1. Spot local patterns. Try to remember the common shortcuts and drug names healthcare experts use in PNG. It'll help a bunch. For example, instead of writing penicillin G-benzyl, they might say Expen or even Benpen. Make a mental list of meds you see often. It'll be like a shortcut in your brain. 2. Tricky dosages. Dosages can be super confusing with all the abbreviations. If you're stuck, check how others usually prescribe similar medicines. Like, if you see TDS on the paper, it means 3 times a day. Easy peasy. 3. Highlight unclear bits. When you see a word that's hard to read, use a highlighter to mark it. It'll remind you to double-check or ask a friend. Highlights equals heroes. 4. Check the numbers. Numbers can look alike, especially in messy handwriting. Focus on telling apart similar ones like 1 and 7. Double-check those units too. MG, ML, and all that. Safety first. Use tech to crack the code. 1. Handy apps. Use cool apps like Drug Search PNG to figure out unclear drug names. It's like a secret decoder on your phone. 2. QR code magic. Wouldn't it be neat if prescriptions had QR codes linking to clear info? It's a cool idea that can make things super simple. Just scan and see. 3. Scan, baby. Scan. Use electronic scanners to double-check prescriptions. It's like having a high-tech buddy backing you up every time. 4. Online info. Look up drug details on websites like MIMS. They're treasure troves of info you can use anytime. Teamwork makes dream work. 1. Create a handy list. Make a cheat sheet of common prescriptions with your team. Share and update it so everyone's on the same page. 2. Open talk. Chat openly with healthcare experts about improving handwriting. Offer ideas like clinic guides to make reading easier. 3. Regular meetups. Hold meetings with colleagues to share experiences and cool ideas. It's like a team huddle to beat the handwriting monster. Long-term plan for fewer mistakes. 1. Go for digital. Push for using electronic health records in clinics. It's like switching to a smart system that clears up confusing handwriting. 2. Standardize stuff. Suggest using forms with printed drug names to avoid scribbly errors. It'll make life a whole lot easier. 3. Teach and train. Organize sessions to show healthcare workers how important clear handwriting is. Teach them to avoid confusing shortcuts. 4. Patient power. Encourage patients to check their prescriptions and ask questions. More eyes, fewer mistakes. Keep patients safe and happy. 1. Double-check system. Have another worker review tricky prescriptions before giving out meds. It's like having a safety net in place. 2. Feedback fun : review mistakes and figure out patterns. It's a super way to make things better for everyone. All done. By using these simple strategies, you'll become a pro at understanding tough prescriptions in no time. Keep pushing for smart systems to make healthcare even better in Papua New Guinea.